Good evening, everybody. So welcome to our presentation, Heart Month. It's February again, and we're here to discuss about the significance of cardiovascular health and what other things that we need to know about taking care of the heart and the cardiovascular system. So next slide. Okay. Okay, well, I guess type your questions in the Q&A. We have a Q&A break during this time. Please unmute yourself to ask. Post-webinar pool will be posted at the end of this webinar. We appreciate if you participate in the poll. And the host will unmute your mic at the beginning of this Q&A. However, please mute your mic if you have background noise. All right, so let's start with the basics here. As I mentioned to you about February being Heart Health Month. So this is a purpose of raising awareness of a healthy heart and encourages healthy habits to reduce risk of heart disease. As we all know, the number one cause of death is in the US is number one is heart disease. And right now, as the relevance of our times, it's also the number one cause of death ranking likely to be impacted by COVID-19. That's why we all hear about people who has high comorbidities to be at a higher risk of mortality if you have a cardiovascular problem, and at the same time COVID-19 comes into play. And of course, February is Valentine's Day, the month of hearts. And in the past, it's been the time when we celebrate Saint Valentine's, who actually started this in memoriam of him, 496 AD in the 14th century. We actually have represented this holiday, or not really a holiday, but a special occasion, as we express our love through flowers, gift cards, and Valentine symbols such as heart shapes, doves, and of course Cupid, the little baby with arrows. And now love is the theme, wherein we see hearts in the eyes of people, butterflies in stomachs, in our little tummies, and husbands and wives, or husbands and boyfriends should probably start digging deep into their pockets, for they know they're going to be spending much for their special someone. But going to the medical aspect of this, the medical side of Heart Month is about the heart, a hollow muscular organ, which actually contracts and is responsible for the systemic circulation of our system. And again, the causes of heart disease really are various, but there's one common theme for this, is it's the thickening and the hardening of the artery wall with fatty plaque, which leads to narrowing. And that's what I want you to focus on, but there are other reasons, but this is our main gist of what we're going to be talking about. Next slide. All right, so heart attack symptoms. As you can see, this is actually the common things that we will encounter. Chest discomfort, number one. It feels like you're uncomfortable, pressure, squeezing, fullness and pain, and discomfort in other areas of the upper body. This is where we feel pain, discomfort, or actually radiation of pain going to the neck, to the jaw, to the left arm, or even the stomach ache that goes along with it. Number three, another picture of a heart attack would be shortness of breath. And other signs that we should recognize are probably non-specific, but it's part of the spectrum, is having cold sweats, nausea, and lightheadedness. So what do you do when you have a heart attack? You call 911 right away. You do not attempt to drive yourself going to the hospital, for the reason that EMS or the ambulance has equipment and they know CPR, just to be sure that on your way to the hospital, you're given the right medications, you're giving the right treatments or preventive measures for damage to occur. And when you're driving, you might have an accident because you might pass out because you're having an actual heart attack. So don't worry about the bill. Worry about that life that you have that you want to enjoy for tomorrow. And then the regular suspects, most of the time when we look at heart disease or heart problems, would be cholesterol. So I want to talk about this a little bit more, but there are other reasons why our arteries can clog up. And other reasons can be platelets, calcium accumulation, immune system acting up on the blood vessel wall to produce inflammation. Overall, it's basically forming a plaque that narrows the arteries, that turns into a blockage, that leads into a heart attack or even a stroke. Next slide. Oh, so what is cholesterol? So let's get into this specific matter. Cholesterol is a waxy substance, but it's not all bad. The thing here, the body is actually using this to build cells, especially cell walls, but too much becomes a problem. Sources of cholesterol would be most of the time would be liver. Liver actually creates what we need to make hormones and other enzymes. And the sources that where we get it from also includes animal sources such as our diet, which is meat, poultry, and dairy products. And also, you have to remember, plants also has cholesterol for us. But the thing here is the bad stigma that's associated with cholesterol most of the time is, of course, the heart attack and also the stroke incidents that we hear along with it. But the good things about it, as I mentioned, we use it for creation of hormones such as cortisol to adapt for our stress response, and also testosterone and also estrogen, which are all reproductive hormones that we need for multiplication of our species. Next slide. All right. So what are the different I guess types of cholesterol and how to actually find our levels? So the way to find out most of the time is through blood testing. And blood testing offers us so many different options. Next slide.
Those are all the slides that we have.
Okay. Well, I guess I'm going to explain this to you then. So for the cholesterol part, we're going to be having bad cholesterol, good cholesterol, and triglycerides. These are the common things that you will see on your typical blood test from your doctor. And the thing here is too much of the bad, as we all know, is actually not a good situation. The thing here is when you have bad cholesterol that's predominant, it increases the risk of buildup of plaque in the inner walls, in the arteries, thus decreasing the blood flow that we all are afraid of. The bad cholesterol actually is the one that builds up in the arteries. The good cholesterol is the one that contributes to the cleanup process or removing these bad cholesterol particles out of our circulation so that our caliber of the blood vessels will be maintained. And again, the thing here is good cholesterol. We have to remember that the higher the levels, the better, which is the HDL. The bad cholesterol is the LDL. And HDL are scavengers. They carry the bad cholesterol from the arteries towards the liver for elimination. And another one that we always see in our blood work is called triglycerides. So triglycerides, the most common type of fat in the body, and what the significance of this is the stored excess energy from our diets. And then as another question arises from this, how can we actually find out from this our cholesterol issues? Your regular doctor usually requests for just LDL, HDL, and triglycerides. You always see that in your monthly or annual blood test. But the thing here is that is actually what we call the old lipid profile. Now we have a new way of being specific and being aggressive about lipid assessments. The thing here is when you see these old panels, meaning there is a new norm now in assessing a specific blood cholesterol issue of a patient. But the truth of the matter is this doesn't tell you anything at all. Yeah, it's what I want to tell you is you would see a normal lipid profile, normal HDL, normal LDL, normal triglycerides, and you will still have a higher incidence of heart attacks and strokes, and even vice versa. The thing here is it doesn't tell you anything at all. The new way to go for testing is the one that you need to tell your doctor is called advanced lipid testing. It's a deeper examination of your cholesterol particles. It compares the sizes, the big, the small, how big or the small or small your bad cholesterol and good cholesterol is, the particle number, how many molecules of bad and good cholesterol you have, the distribution. So it basically tells you the real picture of what your cholesterol family is looking like. And it also is a predictive of the chance of heart attacks and strokes. And this is what we offer in the practice now. We're doing this in Biointegrative Health Center. And at the same time, we have also a genetic test for those of you who's having a hard time controlling your cholesterol and your blood pressure with the tons of medicines and supplements that you've been taking, and it's still not working. Maybe the genetic test will help you a little bit more on this. But again, that's another different topic. But if you have more questions about that, we'll discuss that along the way, or we're going to produce another segment for that. Another question that arises from this topic is what are the risks on having high bad cholesterol? Number one, risk factors that you always hear from your doctor is genetics. They will tell you that it's all about family history of high cholesterol, heart attacks and strokes, hypertension, and diabetes. Yes, they can serve as clues for you that you might get it, but it doesn't mean that you're going to have it. It's just more of really saying that it's your environment that's responsible for this, meaning you can change family heritage, you can change genetics if you change the lifestyle and also the environment that you have. For example, I'm going to give you the second risk factor, which is acquired, meaning these are all based on smoking, alcohol, sedentary lifestyle, diet, and diet is mostly focused on the Western diet, the fast food, the junk food that we have. All of these aggravates the cholesterol issues that we have. And also specifically foods high in saturated and trans fats, refined carbohydrates, fat, all these fats that causes the liver to make cholesterol or processed cholesterol more than the normal, which leads to unhealthy state. And another point that I want to bring out there, tropical oils there that are detrimental to your health, such as palm oil, palm kernel oil, and I'm sorry to be the bearer of bad news here, but coconut oil. Coconut oil had this reputation of being the miracle oil for almost anything, treat autoimmune disease, eczema. But the problem is virgin coconut oil has this ability to increase the bad cholesterol in your system because it's a long chain fatty acid. And unfortunately, I have to tell you this because we just want to break this misconception out there. And so let me throw out some statistics for you guys. So by the numbers, 1 in 200 would be responsible. Genetics will be responsible for the issue of cholesterol in your system. So that's why when your doctor tells you that, hey, it's your genetics, you're doomed to have it. You're really not. 1 of 200 is the statistics for that, meaning majority of the fat accumulation that occurs in our body is because of our diet and it's acquired. Another number out there is 90%. 90% drop in risk of heart attacks when you employ lifestyle changes. See how big that change can be. And 20 to 30% will be the capacity of medications in terms of helping your cardiovascular problems out. So how small of that, if you think about it, when you take your cholesterol medication, your hypertension pill, for the reason that the 70% or the majority of that percent comes from more of the lifestyle changes. That's why medications are only adjunct or supportive therapies. And another one would be 10 years old. 10 years old is the first, first time we will actually find fatty streaks in our arteries. And this is the thing that is showing to us that our young generation is starting to lead a path that is actually shortening their age or their youth making them predisposed to higher chances of cardiovascular illnesses. Again, because of the surroundings that we have, such as diet and lifestyle. And last important statistic here is 3 weeks of eating healthy can actually start to improve the blood flow to your heart muscles. And this actually shows us that if the body given the chance to heal by itself, it will. That's why eating healthy, when I say eating healthy, plant-based diet, Mediterranean diet, which I will talk about a little bit more later. All right, and then let's talk about prevention here. So prevention of increasing cholesterol buildup in the arteries. So number one, quit smoking. Everybody who's a smoker right there, it's a known risk factor to accelerate the plaque buildup in your arteries. When you when you quit it, it cuts the risk in half in terms of cardiovascular problems. Keep that blood pressure steady. Keep that diabetes number in control. A1C, your fasting glucose numbers. Keep them at bay, and that would also equate to a better outcome for your cardiovascular system. And also lose weight. Being overweight and being obese is a higher risk factor. Maintaining that BMI is the best way to go. Regular exercise recommendations from the American Heart Association right now, as we speak, at least 150 minutes per a week of moderate intensity aerobic activity. So an example of that would be walking. Or even you can have another option for that would be 75 minutes per week of vigorous aerobic activity or a combination of both. So vigorous aerobic activity would be running. So you're really sweating, you're really getting the heart rate on the higher level, and you're burning up calories real good. So you have alternatives, and or you can even combine both for better outcomes. Preferably, you spread it out throughout the week. So don't do it in one day, but this is the basic suggestion of our current studies right now. So get up and move throughout the day. Any activity is better than no activity at all. So let's talk about your diet as part of our preventive measures. So eating a heart healthy diet, limiting the saturated fats, not eating much of red meats and sugars. So there are two diets that I would recommend. One would be the Mediterranean diet or the Italian diet. So Italians usually are enjoying high intake of vegetables, fruits, and even bread. They dip their bread in olive oil and legumes, nuts, and seeds. And also, yeah, extra virgin olive oil and nuts are primary fat sources of this type of diet. They do have animal intake also, but in moderation, even low to moderation. And don't forget the wine that is part of the Italian meal. So that also should be taken in moderation and should not be excessively done. Want to take note here of extra virgin olive oil. It actually has proven to enhance the cholesterol improvement of our blood system, and it affects the genes to make sure that the regulation of cholesterol is at bay. And the number two diet that I would recommend would be being on a plant-based diet. Or yeah, I don't want to use the vegan term on this one, but the highlight of this diet is soluble fiber, nuts, soy protein, which is organic, not the fake soy, the GMO soy that we have out there, and plant sterols. It has shown to lower the bad cholesterol and enhances the lipid blood levels that we have that we see in our blood test. And another common question that I get about about preventive measures would be alcohol intake. So what is the best recommendation for that? Again, according to the American Heart Association, 1 to 2 drinks a day for men and 1 drink for women. Sorry about that, but that's only according to recommendations. The thing here is when I defined how much a drink will be, a drink is 1 12 ounce of beer, which is the glass that you get in bars. And for spirits, it's 1.5 ounces. And for wine is actually 5 ounces. So that's your little goblet that you put your wine in. Okay, so now let's move on to supplementation. So this is something that everybody's I'm sure going to benefit from. You can get this anywhere, but again, I would suggest doing supplementation, especially if you have an actual cardiovascular problem, should be supervised by your medical professional. for the reason that we recommend higher doses in our clinic. The thing that I will give out there for you guys is for regular dosing alone for most of the time for maintenance or healthier individuals. Number one would be omega-3 fatty acids, which are coming from fish sources. Fish sources, of course, you have to make sure the fish source is a good source because you might get heavy metal contamination, and also sometimes they're rancid. And you can tell from fish oil supplement when you bite into it, you get gassy, it tastes bad. So you focus on the EPA, DHA that's contained in the supplement. And it's also good for high triglyceride levels if you have one. And the suggestion would be at least 950 milligrams a day, or you can do this even max 3 times a day. Another one is niacin, B3. So my suggestion is taking the sustained release for the reason that your common problem affiliated with this is flushing. The way to avoid flushing, which is avoidable, people think you're always going to get flushing with niacin, is you take it with food or even apples. That lowers down the chances of you flushing with niacin. The minimum dose I would suggest is 250 milligrams. Vitamin E, tocotrienol and tocopherol. Another term for this is gamma delta tocopherols. Use with omegas always because they work in synergy. And the dose that I want to advise is 200 milligrams a day. Berberine, that's something coming from plant roots, rhizomes, and stem barks. It reduces the cholesterol absorption. It works well with red yeast rice. That's something that I advocate for. And 1 gram, of course, in divided doses the whole day. Another one I just mentioned a while ago, red yeast rice. It's related to the fermentation of rice, and the active product of red yeast rice is monocolins, and it has a statin-like property. And be careful about products out there that's not verified or actually coming from professional companies, because there are contaminants called citronine, and citronine has been known to actually cause renal failure. So be picky with with your choices of sources. And that's why the reason why we go for what we call medically grade supplements. And 1,000 milligrams is our suggested dose for that. And also food suggestions that lower cholesterol would be sesame seeds, sesame oils. So go for 40 grams per day. And this can be effective in lowering bad cholesterol. And it also prevents intestinal absorption and increased bile secretion of cholesterol. Another one would be fermented soy. So I want to emphasize on this. Always go for organic soy, or if it's from Japan, hey, go crazy on it. But the soy that we have here in the US, unfortunately, is GMO sourced. That's why it's something that I'm really on the fence about. But if you want to go that route, 30 to 50 grams per day, it decreases fat absorption through combination of fiber. Of course, we heard of genistein. That's also an isoflavone that's part of the properties of soy. And it's actually, again, soy protein is the main source here in the US. Flax seeds, the thing that I want to mention to that is it only applies to flax seed, not flax oil. Flax oil doesn't give you that lipid lowering or cholesterol lowering capacity. And it also has the anti-inflammatory effects that we like. And at the same time, it also has, if taken right, the fiber to make us not feel constipated. Another one would be pomegranate juice, probably pomegranate seeds. The antioxidant effects is, I guess, undescribable. The suggestion would be more of the 1/4 cup 2 times a day. When I mentioned about the juice, I'm worried about the sugar that's in it. So when you buy products outside, that's why I'm more looking towards the actual seeds. But you know the challenge of everyday life. Hey, if you can't go for the juice, if you can go for the seeds, way better. And it has shown to lower the plaque formation in your carotids. And also, lastly, the monounsaturated fatty acids. These are the actual oils. And as I mentioned in the Mediterranean diet, the one that I advocate for is extra virgin olive oil. So for the same reasons that Italians are doing this as part of their secret Mediterranean diet that keeps them into that longevity range. The thing that I want to recommend here is it actually can be used 3 to 4 tablespoons per day, and also in combination with omegas. So, suggestion for how to use this: you can pour it on your salad, you can chug it down for real, like a shot glass. And people are, yeah, they might look at you crazy, but hey, it's for your heart health, right? So, in biointegrative medicine, the field of biointegrative medicine, this is something that we are applying here now in the clinic. The thing that we can offer you is actually lifestyle modification and also personalized supplementation, as I mentioned a while ago, that these supplements that I just said, we give them in higher doses. That's why I don't want you to go in that realm without medical supervision. And we also have the IV therapy, escalation therapy that removes the calcium and also the plaque, softens up the plaques in your our arteries, and also liver cleanses. And also we have our detox remedies for everybody. So thank you for inviting me again for Heart Health Month. I hope you enjoyed that talk.
So can we tackle some questions? Yeah?
Yeah.
Can you hear me?
Mhm.
Tackle some questions. You ready?
Yeah.
Okay. So the first question is, are heart attack symptoms different for women?
Yes, it is. The thing here is, with the reason for that is basically hormonal. The thing here is, you always see in movies the typical clenching of the chest, feeling that you have that feeling that somebody's hand is going in there squeezing your heart. That is the typical picture. You're pretty lucky if you're going to have that, if you're a female. The thing there with female, for females, I have encountered that they're just feeling nauseated. They're just vomiting nonstop. It's a gastrointestinal manifestation. It's a migraine that just would not stop. We do still get the typical presentation of the clenching of the chest, but I'm saying that it's a harder puzzle to figure out if you're a female, just because of the changing hormones. Hormones plays a big role in this. Men, most of the time, they do present the same thing.
All right. Good. Thank you. So our next question is, is a daily aspirin still a good recommendation for preventing?
Right. So that's a good question. In general, aspirin is pretty safe. I'm not, the only thing that you need to worry about aspirin is, of course, it's an anti-inflammatory. It can create ulcers in your stomach lining. That's why if you do chose that route, take it with food. But the newer studies are actually out now that aspirin actually has what we call a genetic predisposition. There are people who are going to take aspirin and actually would not metabolize it, rendering it useless. Again, would that be harmful? Yes, there are some metabolites that will come out of that, that will be detrimental for that specific patient. But again, in general, we do still recommend that because majority of the population does not have it. A majority of them will benefit from it, decreasing the clotting capabilities of platelets to aggravate strokes and heart attacks or even heart conditions. That's why with the genetic test that we do here in the clinic, we find that out for you, and we can tell you, hey, your aspirin is helping you out, or your aspirin is actually detrimental to you.
Great, thanks. Next question is, does estrogen replacement therapy help reduce the risk of heart attack and stroke for women?
That's actually a good question. The thing here is, it's all about the timing. The thing here is, if you are in the perimenopausal phase, that is the best time to talk about hormonal therapy. Hormonal therapy is, you don't want to run the tank dry before you put gas in, because you're going to sputter, your car is going to die in the middle of the road, and you have to get gas somewhere. Hormonal therapy should be addressed in the perimenopausal phase. So when you know the gas tank is low, you add more gas so you can run further. The reason for that is, when you pass the stage of menopause, when you don't have any estrogen anymore, you don't have protection in your cardiovascular system. Now you probably have clots somewhere. You probably have ongoing heart disease. You probably have ongoing cholesterol and hypertension issues. And that's already forming damages in your system. That's why it's easier to use estrogen. It's protective when you use it early. But if you use it late, if you have complications already, for example, if you had a stroke recently and if you had a heart attack recently, I probably wouldn't give you estrogen for the reason that, I mean, for that time being. I'm not saying you're totally excluded from that category, but estrogen can be clot forming as well. That's why it has to be used properly. And my advice for every female out there, perimenopause is the best time to do it. And if you do miss perimenopause, it's not the end of the world. You have at least 5 more years to start on hormone therapy before the increase of cardiovascular illness actually occurs in the female body, just because of drying up of hormones, specifically estrogen. Next.
The next question is, does birth control raise the risk of heart disease?
All right, so that's a good question. The studies have been shown that it actually does, for the reason that you're actually using birth control pills are what we call non-bioidentical. So non-bioidentical meaning these are synthetic medicines. And the thing here is with it's not as a higher risk compared to taking oral estrogen. So oral estrogen has definitely proven to increase cardiovascular risks in a surmountable percent. But when you talk about oral contraceptive pills, definitely there is estrogen in that. And also, not only am I worried about cardiovascular risk increasing, but also I'm worried about the other effects. It actually messes up your own hormone creation, even the neurotransmitters in the brain. It's affiliated with higher incidence of depression and anxiety. It also has a higher incidence of memory loss. That's why playing around with non-bioidentical is not something that I would advise. That's why I always talk about more of natural bioidentical hormone replacement, because it's just almost similar to the molecule of your body, making it more acceptable for the system.
Thank you for that concise answer. Okay, so the next question is, how much, I think you already covered this, how much physical activity? Let me see here. You scroll down. Oh, is salt bad for your heart?
Salt, like table salt?
Like, I don't know. They didn't say. Whoever has this question, if you want to unmute yourself and clarify your question, but I'm guessing it's table salt.
Okay. All right. So that's a very good question. Salt does aggravate your hypertension. When you take in salt, it actually attracts more fluid or water with it. That's why if you imagine if you have high hypertension, there's so much fluid running through your arteries already. And if you add more water in there, imagine how much pressure you're going to add to that load. That's why sodium is always what we call a water attractant. And you would notice that when you take in salt, some people would have swelling on their legs, and it's worse than before without salt. That's why if you have hypertension, I would definitely avoid it. But again, in general, as a preventive measure, yeah, salt is something that should be used in moderation and not in excess. You don't want to put salt in on everything, your cereal or your chocolate bar. You just have to use it wherever you need to use it for cooking, for example.
I think also you have to watch out for salt content, don't you think? Like,
Okay.
you have to watch out for salt content because the items that you think don't have much salt end up actually having a lot of salt, like packaged frozen foods and
Right. And right now, our I guess our Food and Drug I guess information is very strong on this. So every time you flip your product that you buy, you will always see the sodium content in there. So they really are pretty good about that, making sure that people are conscious about these specific numbers.
Okay. So our next question is, if you can hear it, between diabetes and heart health.
What again? Correlation?
What is the link between diabetes and heart health?
Okay. So having diabetes, yeah, that correlation is kind of hard to stitch up. The thing here is there is really something that's going on there. When you think about diabetes, you only think about sugar, and how can sugar be actually affecting my heart health, right? The thing here is when you have diabetes, you have the ability to actually form more fat through what? Through sugar. So when you store sugar in your system, you don't you're expected to metabolize that, or the cell should use it up. But because of diabetes, you have what we call insulin resistance, and glucose cannot get into the cell to be used. And that's how the body utilizes it. It's going to get it and it's going to put it in storage. All right, you're not going to use it. Let me put it in your body as something else. And they put it in storage as fat. And that's the thing. When you have more fat, you have more fatty streaks, you have more cholesterol congestion in your arteries. And being in the state of diabetes actually is being in the state of accelerated heart disease. You have a higher chance of having a heart attack and a stroke compared to somebody who's non-diabetic. Unfortunately, that's how diabetes is. That's why that was a good question, because people think, oh, I have diabetes. I don't have to be worried about heart disease. I have only have to be worried about sugar, which is not the case. Now your problem is sugar and also cholesterol at the same time. Oh, and going back to I want to go back to that salt intake. Now I got the number for you. It's actually 3,400 milligrams per day of sodium. That's the recommended. But again, that's for somebody's who's healthy, who's somebody who has comorbidities. It should be less than 2,300.
And then, how old do you have to be worried about heart health?
As I mentioned a while ago, when you're at age 10, when I mean, yeah, they were doing autopsies and biopsies. They have found that age 10, you already have fatty streaks in our arteries. And the thing here is, right now, the question really is not of a question of age. It's really more of a question of exposure. What are you exposed to? Even maybe a healthy 13 or 14-year-old can have uh, cholesterol that is almost comparable to somebody who is 30 or 40 if they really don't have that regulation or control in terms of intake of fat. That's why it's not a question of age, really. It's really a question of lifestyle and habits. And that's why having an annual checkup with your doctor is something that would guide you through this. Because I know that I've seen so many patients who are in the teens, who are pediatrics, who are saying that, oh, I don't really need to get checked every year, or I don't need a blood test at all because I'm young, I'm healthy. Not really. You'd be surprised that heart attacks happen. It can happen in the 20s and 30s now, just because of, yeah, even the misconception. Oh, I'm thin, I'm lean, I'm a bodybuilder. But if you look at the history of these people, they eat a lot of fat, they eat a lot of meat, they eat a lot of fast food and junk. So it's really all about your assessment on if you think you're eating healthy or not.
Can you just clarify real quick the link between like strokes and your heart, the healthiness of your heart?
All right. So a stroke, let's define a stroke first. So a stroke is actually a part of your brain that actually loses blood supply. And when you think about it, in relation to the heart, so the heart, how can that be connected? It's so far away from each other, right? But the thing here is your heart is the one that delivers blood to your brain. So if your heart is not actually pumping enough blood going to the brain, so what happens? A piece of your brain, a part of your brain is going to die because it's not getting the right amount of blood flow. And you can actually have a stroke from that. It's called ischemic stroke. Or there's also another possibility that your heart is not beating right, it's not pumping right. It can form clots. So as it forms clots inside because of the uneven beat, like atrial fibrillation, you can now spit out a clot through through the from the heart going to your brain, giving you another blockage that actually would lead to a stroke. And again, cholesterol plays a big role. If you block blood vessels going from the heart to the brain with cholesterol plaques, that can also act as an obstruction to decrease the blood flow to the brain, leading to a stroke.
And would you say that keto diet, like, is not a good diet to follow if you have like a heart condition or you have heart disease? What are your thoughts on
Yeah, so that's a good question. Keto diet actually is a good diet. I have to tell you, if done right. The thing here is the misinterpretation of keto diet of the public. I have seen keto diet, especially from bodybuilders. They're eating butter, they're eating fat, pork, they're eating all the junk fat that is out there, and thinking that is the one that was meant to be part of a keto diet. But the thing here, it was actually misconstrued, especially by media, misinformation, social media, TV, that it's all about, yeah, keto diet or for bodybuilders, you need to get all the animal meat that you need to put in your system. But keto diet really is more focused on plant-based oils. So the one that I just mentioned a while ago would be a good example would be extra virgin olive oil. That's the one that has proven that it's a good source of energy because it can be oxidized. As we all know, as we burn fat, you have more energy that we can produce from it. That's why we use that instead of glucose. That's the main heart of the keto diet. You're lowering down the carb intake and you're increasing the fat intake because it has more potential for energy. But the thing here is you have to use the right sources. There are MCTs, mid-chain triglycerides. You have nuts, nut oil that you can get. You can, as I mentioned, all these plant-based oils are out there. So don't misinterpret it. Keto is healthy if done right.
Okay. Thank you, Dr. Nario, for answering all these questions. So we're going to open up the question and answer session to the floor. So if anybody has a question, if you just want to unmute yourself and answer the question. And then while we're doing that, I'm gonna launch the poll. So if you could just answer the poll questions, that would be great. Thank you so much for participating. We appreciate it. Is there any questions out there that anybody has? So, let me see if there's more questions in the chat. Oh, here's another question. Would fasting be helpful for heart health?
Yes, it is. For the reason that fasting actually puts your body in starvation mode. So what happens in starvation mode? You're going to use up all the energy sources that is left in your body. So that's why, yes, stored glucose will go, stored fat will go, and the last one to go would be proteins. So you don't want to go that far. But when you start burning proteins, you're actually in that stage of prolonged fasting. You know that that is a bad way to go already because you're losing muscle mass. And fasting, you would hear about intermittent fasting, not eating almost 8, 12 hours, and even 24 hours. Those are actually good. And you don't have to worry about these specific types of fast because they're not affecting the burn up of muscle. With fasting diets, the only thing that I would caution you is if you have a medical condition such as diabetes, because if your blood sugar goes down, of course now you have to, if you're taking insulin, those are the complicated things that would render you helpless in relation to being hypoglycemic. That's why fasting should not be done without medical supervision. You have to make sure that you get checked first if you have certain restrictions that would hinder you of not doing that. Another good example would be, for example, cachectic patients who are cancer patients. We promote fasting for cancer patients, especially in light of doing chemotherapy. But the thing here is that you're very cachectic. You don't have any meat at all in your system. Why fast still? It's actually going to be detrimental for your system. So that's why I am a big fan. I do it myself. The thing here is you just have to be careful when you know you're starting to have hypoglycemia, you're shaking, your diaphragm, you're sweating, you're cold. You need to put that sugar back in there so that everything can be stabilized.
What do you mean by fasting? Do you mean like no eating for one day, like how the
Yeah.
Catholics fast, or do you go with one meal and then all liquids for the rest of the day? Like, what is
So
your definition of fasting?
right. So there are different ways of fasting. So there is water fasting. Well, when you talk about one meal a day, that's not fasting anymore because you're putting food back into your system. Fasting is putting your body in a state of starvation so that you can utilize energy sources properly that are stored in your system. But when you break that cycle when you introduce something, for example, a small meal, then you go back to ground zero and start counting again in terms of fasting. That's why water fast is okay for the reason that water does not have any calories. It does not contain carbs, proteins, or even fats. It's more of hydration, so that's okay. I've seen that before. But when you talk about fasting, I'm talking about the hours. So when you go to your lab, your doctor will tell you 8 hours of fasting or 12 hours of fasting. So that's a perfect example that you're already practicing intermittent fasting then. But if you really go gung ho, you would see patients going, or me, I've done it like 18, 16, 18 hours, or even 24 hours, even days. And that's the thing. You have to be doing this gradually. You have to find your tolerance for the reason that sometimes it can be dangerous as well. That's why this is supposed to be something guided by a professional if you want to go extensive on this.
And then the last question on the chat was, is low testosterone, can that be linked to heart disease?
Yes, it does. The thing here is low testosterone has the, again, our when we think about testosterone, we're thinking about muscles. We're thinking about vitality for a male. The reason why I myself, or hopefully other providers out there, looks at testosterone is because of cardiovascular health. Testosterone is related to ED, not erectile dysfunction, but we call this endothelial dysfunction. This is the lining of your arteries, the lining that protects you in relation to formation of plaques, hypertension, cholesterol buildup. If you have that intact endothelium, you have a better protection or in prevention from these diseases that I mentioned about. Testosterone testosterone actually makes that lining intact and actually healthy. If you have low testosterone, this lining right here goes away slowly, and disease in the cardiovascular system starts to ensue. That's why find a deeper reason to replace testosterone. Not only because you want to have a bigger body for sexual benefits, for vitality. It is for vitality, but it's really more for longevity and cardiovascular health.
Okay, if no one has any questions they want to say, that is the end of our webinar. Thank you for answering our polls. Thank you for participating. And we do have a webinar tomorrow also. So one of our bloggers is gonna, is going to present it. It's a lot about how to take care of yourself and how to be good to your body and to your mind. So if you wanted to join us, it's at 5 o'clock tomorrow also. And so you can register on our website, bihcireno.com. All right, if there's any more questions, have a great evening and thank you so much for spending it with us.